Hi, my name is Manita, and the first skill I'm going to be demonstrating is going to be the adult BLS with the ambu bag and the AED. I also have my skills test and checkout sheets and my components for BLS provider sheets. The first thing you want to do whenever rendering aid or CPR to a victim, you want to make sure the scene is safe. You're going to look around, make sure there's nothing that can harm you while you're rendering aid to the victim. Okay, the scene is safe. Next thing you want to do is check for responsiveness. Tap and shout, hey, you're okay, wake up. He's not responding. Now you want to check for breaths, check for breathing. You're going to look for the chest to rise. You're going to also place your 2 fingers on the carotid artery closest to you to see if you can feel the pulse. There is no pulse. Next thing you want to do is call for some help. Whoever may be around you, these days everybody has their cell phone, but if you don't have a cell phone, somebody, shout for somebody to come help you. Hey, can somebody call 911? Hey, can somebody get the AED to have your help on the way to help you while you're providing aid to your victim. Okay, the first thing you want to do is start with your compressions. No matter if it's 1 or 2 rescuers with adult CPR, you're going to use a rate. You're going to use a compression rate of 30 to 2. So that's going to be 30 compressions to 2 breaths. Also, you want to give your breaths over at least 6 seconds. And you're going to compress at a depth of 2 inches. You're going to place your hand on the lower half of the sternum or the breastbone. So you ready? Let's get into it. 3, 2, 1, go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right, when using your ambu bag, you want to make sure you do what is called the EC to get a good seal to deliver your breath. So what you would do is you would, one is going to be your E, your finger is going to be your E and your C. So you're going to place your hand over the bridge of the nose and your fingers on the forehead, tilt it back. Good seal. You're going to have your E and your C, and you're going to give 2 breaths. 1, 2. And you're going to go right back into your compressions. Ready? Go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. All right. Our AED is here. Now that I have already demonstrated on how to do compressions, like I say, no matter if it's 1 or 2 rescuers with adult CPR, you're going to always use 30 to 2. I've demonstrated that. Now I'm going to demonstrate the AED. So I'm going to pretend that the other rescuer is going to take over doing my compressions, and I'm going to focus on how to use the AED. The first thing you want to do when using the AED, you want to make sure you turn it on. And also make sure, being that this is the adult victim, we want to make sure we use the correct pads, okay? So we're going to use the adult pads for our adult victim. So I have my AED, I have my pad, I'm going to turn it on and follow the prompts.
This is a training device only. No shot will be
cut it on, plug in your pads.
Analyzing rhythm.
Attach your pads.
Stand clear.
Upper right.
Shock advised.
Stand clear.
Charging.
Don't touch your victim.
Stand clear.
Make sure everything is clear.
Everyone stand clear.
I'm clear, you're clear, everybody's clear. I'm shocking. It's telling me to push the shock button, so you're going to follow the prompts. So I'm pushing the shock button.
Delivered. Begin 5 cycles of CPR.
Okay, I'm going to resume my CPR. And remember, the other rescuer is doing the breath, so I'm going to continue with my compressions.
1 minute and 30 seconds of CPR remain.
Breath, breath, go. Breath, breath, go.
1 minute of CPR remain.
Breath, breath.
Seconds of CPR
Breath,
remain.
breath, go. Nine 30. Breath, breath, go.
Analyzing rhythm.
Stand clear.
Everyone stand clear.
I'm clear, you're clear, we all clear. It's checking for a rhythm. Don't touch the victim, because if you touch him, you might get shot.
5 cycles of CPR.
All right, and we're just going to continue.
Analyzing rhythm.
And we're just going to continue repeating the steps. You will do this until the EMS team arrives to take over to provide more advanced medical services, or until your victim becomes responsive again. So let's recap. When you're providing when you're providing CPR to an adult victim, no matter if it's 1 or 2 rescuers, you're going to use the ratio 30 to 2. 30 compressions to 2 breaths. You're going to always make sure your scene is safe. You're going to check for responsiveness. Hey, are you okay? Check for breathing. Activate your EMS system. Hey, go get some help. Call 911. Get the AED. Start your CPR with compressions. 30 compressions to 2 breaths. When the AED arrives, you have to work around each other. One person's going to be doing the AED. The other person's going to be doing your breaths and compressions, vice versa. And you just keep going. Just remember, when you're doing compressions, to allow for the chest to have complete recoil, okay? So you want to make sure the chest is completely recoiling. You don't want to keep leaning in on the chest. You want to allow it to recoil to maximize your compressions and the blood flow and getting the oxygen, everything flowing to the brain, the heart, and all those vital organs, okay? So stay tuned for more of my training videos. Thank you.